September is Ovarian Cancer Awareness Month. More than 14,000 people in the U.S. will die from that disease this year.
Which is why you should know the signs. Shelley Botat shows us what to look for in Health Watch.
This year, more than 22,000 women in the U.S. will learn they have ovarian cancer. Marlene Krueger and her husband Jim were on vacation.
And I felt fine. We were having a ball.
But she did notice her stomach was bloated.
And I thought, oh, I just was eating too much.
When they returned home, she was still bloated, but...
Stepped on the scale, I had lost weight.
So Marlene went to her nurse practitioner, who found a mass and sent her straight to Dr. Peter Johnson, Director of Gynecologic Oncology at Aurora BayCare Medical Center, for more tests.
Ultrasound initially, and then we'll further evaluate with a CAT scan.
Dr. Johnson was able to quickly diagnose Marlene.
Ovarian cancer.
Just in shock, I guess.
Within a couple days, Marlene was in surgery to remove the cancer that had spread.
Hysterectomy, a complete one. Part of my stomach, part of my colon, my appendix, my spleen.
If we can do surgery up front, we do surgery. Then we follow that with chemotherapy.
Marlene is still on an oral chemotherapy regimen.
At the present time, her disease is stable. The numbers have dropped way down, showing that there's very little active disease.
Dr. Johnson says women should know the signs of ovarian cancer and see their doctor if they notice any.
Bloating every day or most every day for 3 weeks in a row, change in urinary habits, change in bowel habits daily, almost daily, 3 weeks in a row, abdominal pain that doesn't resolve.
Dr. Johnson says going to a gynecologic oncologist improves an ovarian cancer patient's survival.
We have additional years of training in how to help women with gynecologic cancer. So the benefit is you're going to live longer if you have surgery with a gynecologic oncologist.
Thank you for what he did. He was wonderful. Without him, I wouldn't be here. That I know.
And Marlene and Jim have big plans for the future.
We do a lot of dancing, a lot of walking, and we like to travel.
Dr. Johnson says the biggest risk factor for ovarian cancer is heredity. Marlene's mom and sister both had ovarian cancer. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.
Thank you, Shelley. This may look like a breath strip, but it's doing a lot more than freshening up. Tomorrow in Health Watch, how these blue strips could help those living with Parkinson's.